Most infants vomit milk at least a few times during the first few months after they are born. There is usually nothing to worry about in most of these babies. However, as normal as vomiting is, it can also be worrying for parents. Occasionally, vomiting can be a sign of a serious illness or complication. But for most babies, vomiting and reflux occurs simply because the gut is still developing. Let us understand some of the more common reasons why your baby could be having vomiting. If your baby is bringing up breast milk, he may have reflux. This is also known as possetting or spitting up. Reflux happens because the tube that carries your baby's food to his stomach, which is also known as the esophagus, is still developing. And because of that, the milk can leak back up after a feed and can come out of your baby's mouth or nose. It affects up to 50% of the all babies, and is usually nothing to worry about in most instances. And it should clear up on its own as the infant's digestive system matures, and usually these types of vomiting disappears by the time they are about 18 months of age. It can sometimes be difficult to tell the difference between reflux and vomiting. If your baby is just dribbling a bit of milk after each feed, it's probably nothing to worry about. But if he is vomiting more forcefully after feeds, it could be a sign of something other than reflux. In such instances, it is important that your baby is seen early by your child's doctor. Immune system of young infants is still developing, and due to this reason, they can catch viruses that are going around. If your baby does have a virus, his vomiting can come on suddenly as repeated vomiting, and it can get better within a day or two. He may also have other symptoms such as diarrhea, vomiting, or tummy pains. In many cases, a virus just needs to run its course, and you can care for your little one at home. But if he has fever or any other symptom that concerns you, or he's not getting better within a few days, it is important that you seek medical advice for your baby. Sometimes vomiting can be a presentation of a serious infection such as a urinary tract infection or meningitis. If your child is unwell with vomiting and has high fever, get him seen early by your child's pediatrician, as these conditions need early intervention. Your baby may be having vomiting if he has a tendency to react to food he is eating. Most commonly, young infants can mount a reaction to cow's milk, and vomiting can be a presenting symptom in cow's milk protein allergy. Other allergens include eggs, wheat, and nuts. If your baby has an allergy, he may also have other symptoms like diarrhea, swelling or itchiness around his mouth, nose, or eyes, and appearance of a rash. These symptoms usually come on shortly after eating or drinking a potential allergen. It is important that you seek medical advice in the presence of such symptoms, as you and your baby may need excluding certain allergens while breastfeeding in order to prevent recurrence of such allergies. If your baby's food or drink has bacteria in it, this can cause a stomach upset. If he's formula fed, this can happen if his teats and bottles were not properly sterilized, or if he drinks formula that wasn't made up according to the instructions on the pack. If your baby has started solids, it can happen if he eats something that's contaminated with bacteria. The symptoms of food poisoning are mostly similar to those of a viral infection. Your baby may have a fever, diarrhea, or tummy pain, as well as he may look very unwell. Symptoms can start anywhere between a few hours to a few weeks after having contaminated food or the drink. Rarely, repeated vomiting in a sick infant may indicate an underlying obstruction within the gastrointestinal tract. These infants are often very unwell and they need urgent attention by the pediatrician and the pediatric surgeon. It is crucial that your baby is seen without delay if they have greenish vomiting or vomiting that is associated with blood-stained stools. Usually, vomiting in most infants is nothing to worry about, and soon they get better. This is mostly true if they have reflux, viral infection, or food poisoning. The most important thing is to continue feeding of your baby to protect him from dehydration. If your baby is breastfed, make sure that your baby is breastfed well. If you're concerned that your baby could be becoming dehydrated, it is important that your baby is given enough oral rehydration solution. If your baby is on solid foods, don't worry if he doesn't have much of an appetite for food. If he is unwell, it's much more important to keep him hydrated. If your baby is over 6 months and does feel like eating, it is best just to offer his usual foods. If your baby has other symptoms or seems to be in pain, it's fine to give him the recommended dose of infant paracetamol. If you are in doubt about how much is safe and when to give, seek medical advice. Occasionally, vomiting is nothing to worry about. But if your baby is having repeated vomiting, it can sometimes be a symptom of a condition which is more serious. Frequent forceful vomiting, particularly if your baby is under 2 months of age, can indicate possible upper gastrointestinal obstruction that is commonly due to a condition called pyloric stenosis. Bringing up green or greenish yellow vomiting can be a sign of a blockage in your child's intestines. It is very important that your child is seen without delay in the presence of these symptoms. Blood in the baby's stools can sometimes be a symptom of an infection or allergy. This warrants early attention by your child's pediatrician. Babies can become easily dehydrated compared to adults, particularly if they are having repeated vomiting. If your baby refuses all food or drink for more than a few hours or can't keep any fluids down, he is at risk of dehydration. Seek urgent medical advice if your baby has signs of dehydration such as fever, wet nappies, a dry mouth, crying without tears, unusual drowsiness, fast breathing, or a sunken soft spot on the child's head. If your baby has repeated vomiting that affects fluid intake, the doctor may decide to give intravenous fluids to support your child's hydration. Your doctor will check your baby over and ask about other symptoms, and he will try to work out what's causing the child's vomiting. In most cases, it will probably be nothing to worry about, and your doctor will just give you advice on how to keep your baby comfortable. However, in the presence of specific symptoms suggestive of an underlying infection, allergy, or obstruction, your child is likely to receive specific treatment based on the underlying cause of vomiting.